Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Thank you for joining us today in our first video of the series for shoulder pain. You're here because you found us online on Facebook, through your doctor's office, through a brochure. Your friend told you to visit us on the web and check out our online courses. Anyhow you found us, thank you for joining us. Thank you for being with us today. We appreciate it. Congratulations to you for taking the first step and figuring out exactly what's going on with your shoulder. Finding out what is going on and being able to properly diagnose it helps in the healing process. So a lot of people take a shot in the dark or just start fumbling around the internet and trying to figure out what diagnosis they have. This is kind of a really good first step to figure out what's going on with your shoulder. So the causes of shoulder pain. So we have rotator cuff tear, impingement, and tendonitis. So we're going to go right with the rotator cuff tear. Now this is a very widely diagnosed injury, and it's also something that people call a rotator cuff, rotator. There's varying degrees of what people will call your rotator cuff. It's a rotator cuff. All right. So what happens is there's your little scapula, and again, my drawings are terrible. And on here, this sits out, and here's your arm. So why are these so common in people? So what happens is you have your little acromion that sits out here, which is this bone right out here, and here it is right there. So what happens is this comes across and it attaches at your shoulder joint. So here's the little ball of your shoulder. So just to kind of give you a little bit better picture, here's the ball, which is this part of your arm, your humerus, okay? And then here is the acromion, okay, which is the top part, the top bone of your shoulder. So what happens is you have a muscle that goes right through here, called your supraspinatus. Name's not important, but that's what it's called. This muscle goes through here. Now, if you were an overhead athlete, swimmer, volleyball player, whatever, your sport was played overhead, what has happened is over time, this little bump underneath the acromion becomes bigger, and it closes off the gap that was meant to be in between your humerus and your acromion. So what happens is you wind up pinching that muscle. So every time you raise your arm up, you wind up closing this gap. So when this gap closes, you pinch the muscle. So literally, you're sawing away at that rotator cuff as it goes through that little gap there. You're literally just piecing it away every time you raise your arm above your head. Every time you pinch that gap fully closed, you wind up with a little bit of a micro tear. Now these micro tears become a little bit bigger and a little bit bigger. Now the good news is that a lot of times this is treatable, and a lot of times it doesn't require surgery. But what you're going to feel is you're going to feel some pain, and you're going to feel some pain overhead. And we're going to go through in the next video kind of how you can diagnose if this is what you have at home, all right? Go through some tests that you can do just to kind of check out if this is what you have. But this is the main cause of this bone kind of banging into that acromion and starting to literally saw that muscle. A lot of people will come in, into us and say, my doctor says I have a rotator cuff tear, I don't know why he won't surgically operate. We just want to get this done and over with. Well, the problem is if they go in and surgically operate, and this bone and this bone still are pinching that off, then we have a problem. So a lot of times what we're going to do, and we're going to go through this in the third video, some exercises you can do to actually pull this bone downward. So the goal is to pull that down, so that way it leaves that gap that is there and allows that muscle to move freely. So rotator cuff tear. Now there are other muscles in your rotator cuff that can be torn. It's not just your supraspinatus, but that's the one that's most commonly torn. But usually it doesn't matter which muscle of the rotator cuff tear or rotator cuff is torn, they refer to it as the rotator cuff tear. And generally it just means one muscle. It could mean more than that, but generally it just means one muscle. So impingement. So impingement is the kind of the little sister to the rotator cuff tear. So that impingement, so this bone and this bone, so this is your humerus, which is your arm bone, and this is your acromion, which is the top bone on your shoulder. When they close this gap, okay, and this starts becoming more and more upwardly displaced, you start to get impingement. You start to pinch off this muscle. So that's why I said this is almost the precursor to that. When you have impingement, there's some issues there that are going to probably lead to a rotator cuff if they haven't already. So this is, you know, you're going to have pain when you reach overhead. You're only going to be able to reach to a certain point. It's going to feel like a pinch. And that's more of an impingement. The difference between a rotator cuff and an impingement in terms of what you feel is in a rotator cuff tear, you generally will have about 20 degrees where it hurts, and then you'll go through it and it'll get better. So it'll feel good, 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 not good, not good, not good, good. All right? An impingement, once you get past this 90-degree mark, it's just going to hurt the whole way through. All right? So this has a painful arc, as we refer to it. This, once you get above 90 degrees generally, it's going to hurt. And you will be able to twist your arm a little bit in one way or the other to make that bone clear a little bit better. But all in all, this is going to eventually lead to that if that's not treated. So a lot of time people notice that, excuse me, they'll start to not lift overhead with their left hand, or not lift overhead with the right hand, whenever they're starting to feel the pain. That's not the way to handle it. What you're doing is limiting your scope of your quality of life. But not only that, you're gonna start to weaken that muscle, which means it's going to get frayed a lot easier, which means it's going to get torn a lot easier. So you want to make sure that you are really being careful. If this is what you're feeling and you're starting to feel pain when you reach above your head, then you take care of that ASAP and don't wait, because it's a sign of something that's already going on and can lead to something worse down the road. The last one is tendonitis. Tendonitis is just an overuse. Now there's a lot of muscles in the shoulder, so there's a lot of muscles that can have tendonitis. So I'm not going to go through each one of these specifically, but we'll go through ways to kind of diagnose some different ones when we talk more about that in the next video. But this, you're going to feel just achy, you're going to feel pain, you're going to probably be able to push on a muscle and feel some increased pain. Overhead athletes get a lot of tendonitis. If you do a lot of repetitious movement, you're going to have this tendonitis. Biceps tendonitis is probably one of the most common forms that we see, but like I said, there's a whole bunch of different muscles. So you're going to have aches. You're going to wake up with more of a stiff arm, and you're going to have things that, you know, it's more of an ache than it is anything than a pain, and you're going to have it kind of the whole way through movement. Everything's going to hurt. Now, maybe one or two specific movements hurt, depending on where the muscle is more active. That's totally normal, but you're going to have that just dull ache, and it can lead to a sharper pain if it's left untreated. Now, one of the common questions I get is, well, how do I know if I have frozen shoulder? So frozen shoulder is not a very big common cause of shoulder pain, because frozen shoulder happens after this, or after this goes ignored. So if you've ignored this, and this long enough, you can get frozen shoulder. What happens is you have your little humerus, and what happens is around your shoulder joint, you have saran wrap that literally surrounds it. It's called the capsule. That capsule needs fluid. The only way to get fluid to that capsule is movement. So, you know, when I was talking about impingement and people stop, they stop here. They start to stop here. They start to limit how high they reach over their head. So that's fine. So now what you've done is now this entire capsule is not getting fluid because you're not stretching it out all the way. You're not reaching to the limits of what it could be. So part of this capsule starts to dry up. Alright, so now you have all this capsule that you can still use. But this one, it's still there, but it is like, it's locked. It's like somebody injected you with super glue right there. So now you can only reach your arm up, let's say, this high. Alright, so then that's going to start to hurt because once you start to touch the regions of where the super glue is, it hurts. So you're not going to go up to the top and touch where the super glue is. So now your capsule is going to start to freeze even more. So now you're missing this much, okay? And now you're only able to lift your arm to 90 degrees. Alright, or to 100 degrees. Well, same thing happens. You're not going to want to reach up to the outer limits and really touch where that super glue starts because it's painful. So then you're going to just knock off another part of your capsule. So here, this whole part now has become cement. It's not moving, and neither is your arm. So if you have somebody try and move your arm, and you physically are unable to move it past here, not, I can move it, but it really hurts. Physically, like if you were to crank on it, you feel like your whole shoulder would rip apart, that's frozen shoulder. That's completely preventable. But unfortunately, we see it because people ignore when these three things are going on, or any one of these three things are going on. So don't ignore it, okay? When you have this type of pain, it can get worse. It can become frozen shoulder, but that's down the line after these get ignored and not diagnosed. If you're sitting there and you're trying to figure out which category you fit into, because this is, you have a little bit of this, you have a little bit of this, you have a little bit of this, don't worry. Not many people fit into one category. That's not uncommon. A lot of times people who have ignored their shoulder pain long enough have a little bit of this, have a little bit of this, have a little bit of this. So if you're sitting there and you're like, well, yeah, I think I'm in there, I think I'm in there, I think I'm in there. Next video, we're going to show you kind of how you decipher where you are. But even after next video, you may still fit into all three of these categories. And you may start looking and saying, oh my gosh, I think I might have frozen shoulder, or the beginnings of frozen shoulder. So just realize that this is not a cut and dry, you definitely have this, you definitely have this, you definitely have this. You can have all three. You can have two of the three. You can have one of the three. It's not uncommon for this to be occurring, for these things to be occurring in conjunction with each other or independently. So next video, we're going to go over how you can diagnose some of these things at home, special tests that you're going to be able to do to differentiate what type of injury or what type of shoulder pain you have. I look forward to seeing you then.